वेलकम बैक टू द सेकंड हाफ ऑफ हेल्थ मैटर्स प्रोग्राम। और नाज़रीन, जैसे कि हम जानते हैं कि हम पहले हाफ में डिस्कस कर रहे थे कि ये जो पब्लिक हेल्थ क्या है और यहाँ बर्मिंघम में पब्लिक हेल्थ के कौन से मेजर इश्यूज है। और हमारे साथ स्टूडियो में मौजूद है डॉक्टर एड्रियन फिलिप्स, डायरेक्टर ऑफ पब्लिक हेल्थ, यहाँ बर्मिंघम सिटी काउंसिल में काम करते हैं। और इनकी रिस्पॉन्सिबिलिटी है कि जो बर्मिंघम के 1.1 मिलियन सिटीजन्स हैं इनके हेल्थ के बारे में वो लुक आफ्टर करते हैं। और हेल्थ जो पब्लिक हेल्थ है इसका ये मतलब नहीं है कि हॉस्पिटल्स या डॉक्टर्स, इसका मतलब है जो जनरल पब्लिक हेल्थ है। और इन्होंने बहुत सी चीज़ों का हमें बताया है, जैसे कि चिल्ड्रन ओबेसिटी का इन्होंने हमें बताया है कि डायबिटीज एक बहुत बड़ा इश्यू है। और इन्होंने ये कहा है कि एक्सरसाइज बहुत ही इम्पोर्टेंट है, वेरी वेरी इम्पोर्टेंट है कि हमारे जो सिटीजन्स है एक हेल्थी लाइफस्टाइल के लिए उनका एक्सरसाइज करना बहुत ज़रूरी है। इन्होंने ये हमें समझाया कि इसका ये मतलब नहीं है कि हम स्ट्रेट अवे दौड़ना शुरू कर दें या एक मैराथन रन करें, पर हम स्लोली शुरू करें और बिल्डअप करें। और ऐसा ही हमारा एक बर्मिंघम में प्रोजेक्ट है जो है सहेली वुमेन्स प्रोजेक्ट। चलते हैं एक छोटी सी वीडियो क्लिप की तरफ जो हमें बताएगा कि सहेली वुमेन्स ग्रुप हमारे बर्मिंघम सिटीजन्स के लिए कौन सी सर्विसेज ऑफर करती है एक्सरसाइज के बारे में।
Today we're doing the 10k run. I was a bit nervous, but we're all a bit nervous, so we're all going to be encouraging each other, and we're all going to finish together as well.
I think it gives us lots of confidence to do it together.
Yeah.
Which something I know myself, I would never have done it by myself. So if I can do it, I think anybody can do it.
I know it's not just me, there's others in my situation, so we all help each other as well. Sometimes I have my lows and there's someone there to push me. There might be somebody else in the team who's low on another day, and then it might be my turn to push them.
And I'm just seeing it as part of the exercise we normally do. So I'm actually just going to treat it as my normal training. But I don't do it for competitiveness, I just do it to enjoy the run with my friends that I've joined as a group. Unless they try it, they won't know what it's like, the changes it makes in your life, not just from a social aspect, from a health aspect, and your own self-esteem and confidence.
ये था हमारा छोटा सा वीडियो क्लिप जो था एक्सरसाइज के बारे में, जो सहेली वुमेन्स ग्रुप यहाँ बर्मिंघम में मौजूद है। आप उनसे कांटेक्ट कर सकते हैं और अगर उनको ज्वाइन करना चाहते हो तो आप ज्वाइन कर सकते हो और उनकी एक्सरसाइज की क्लासेस में हिस्सा ले सकते हो। जैसे कि हमारे डायरेक्टर ऑफ पब्लिक हेल्थ ने फर्स्ट हाफ ऑफ द प्रोग्राम में बताया कि एक्सरसाइज और फिजिकल एक्टिविटी इंपॉर्टेंट है, उन्होंने ऑल्सो ये कहा कि हेल्थी ईटिंग और अपनी सेहत का ख्याल रखना, जो हम खाना खाते हैं उसके पोर्शन साइज का ख्याल रखना बहुत ही इंपॉर्टेंट है। चलते हैं एक छोटा सा वीडियो क्लिप की तरफ जो हमें बताएगा हेल्थी ईटिंग के बारे में।
The traditional South Asian diet can actually be very healthy. There are so many healthy traditional ingredients, such as an array of spices, such as ginger and garlic, the dals, chana, moong, rice, wholemeal atta, chana atta, jowar or millet or bajra atta, loads of delicious vegetables such as bindi and brinjal, and exotic fruits like papaya and mango. So it's possible to eat really healthily. The problem is we eat perhaps too much in terms of portion size, and we need to be careful of our cooking methods. People from South Asian communities, especially men, tend to be more at risk of heart disease than the wider population. Also, when you're more overweight, you're more at risk of diabetes, and type 2 diabetes is far more common within South Asian communities compared to the wider population. Food plays a huge part within our community structure, but it is important to be careful of cutting down on portion sizes and fats and sugars to help us lose weight. If you use ghee or butter in cooking, it's healthier to swap to an unsaturated oil, such as rapeseed oil or corn oil or sunflower oil. And we tend to just pour oil straight from the bottle because that's how recipes have been handed down, but it's far better to measure. Measure what you're doing now using a tablespoon and gradually start to use less. Aim for about 1 to 2 tablespoons of oil for a dish that serves about 4 to 6 people. If you're worried that your onions and spices are going to burn in the pan because you're now adding less oil, just add some hot water or even lime or lemon juice, and that will prevent it sticking. Traditionally, when we cook a meat curry, we might fry the onions and spices, but there is enough moisture and fat in the meat for you to put everything in the pot together and cook a delicious curry. After cooking a curry, we often get this oily layer on top. You can reduce the oil by skimming it off with a spoon or using a kitchen towel just to dab the excess oil. Some of the ingredients we use are high in fat, especially saturated fat, but there are some simple swaps we can make. For example, swap fatty meats for the leanest meat you can afford and avoid the skin on poultry. Foods like paneer, which are full fat, it's very difficult to find a low fat alternative for unless you like tofu, but perhaps use less or eat it less often. Swap creamed coconut for a lighter coconut milk, and if you're using cream in dishes like korma, try a Greek yogurt or a low fat natural yogurt instead. If you're in the habit of spreading butter or ghee onto roti or chapatis, why don't you try this? Just spread it on one of the chapatis, put the other one on top and rub them together. That way you're cutting it by half. We tend to fry samosas, and you might have tried grilling them and think that doesn't taste very good. Well, here's a tip. Take some oil and brush the oil over both sides of the samosas and bake them in the oven. When they come out, they're brown and crispy, and they will have absorbed much less fat than they would have if you deep fried them. Avoid fried snacks like jera, gantia, sew. Try a handful of nuts or some fresh fruit instead. Sugary foods tend to also be high in fat and calories, so they're really not very useful if you're trying to lose weight. Within the South Asian communities, there's always an excuse to eat some mithai like burfi or gulab jambu or penda because there's a wedding or a religious festival or the birth of a baby. So all this mounts up. The idea is to choose them less often, and when you do eat these sweets, eat less. People often drink glucose drinks or blackcurrant cordial thinking that they need this for energy, but actually it's just pure sugar and can make you put on weight. Instead, try having diluted fruit juice or any unsweetened fruit juice once a day with a meal. Eating too much salt can make you more at risk of high blood pressure, and when we cook we tend to pour salt straight from a container. How about measuring it with a teaspoon and gradually using less? We have so many delicious spices such as garam masala, haldi, jeera, dhania that we can use to flavour food. Even lime and lemon juice can help you to use less salt. Being active is a necessary part of helping you to manage your weight, and this doesn't need to be formal exercise like joining a gym or taking up a new sport. It could be as simple as walking your children to school, kicking a ball in the garden, or doing some vigorous housework. And it isn't that difficult if you take it gradually, if you choose small steps. Managing your weight can help to reduce conditions such as diabetes and heart disease. You can do this by making simple changes yet still eat your traditional foods.
For more information, visit www.nhs.uk.
और नाज़रीन, ये था हमारा छोटा सा वीडियो क्लिप जो हमने आपको हेल्थी ईटिंग के बारे में बताया। जैसे कि आप जानते हैं कि फर्स्ट हाफ ऑफ द प्रोग्राम में हमने बहुत से मेजर इश्यूज पब्लिक हेल्थ के बारे में डिस्कस करते हैं। चलते हैं एक बार फिर अपने स्टूडियो गेस्ट की तरफ। We've spoke about some of the big issues around coronary heart disease and diabetes. Is there anything else that is big that we need to worry about here in Birmingham?
Well, as I said before, there are lots of things, but I think for me there is a kind of unholy alliance between not doing enough activity, which could just be switching the television on and off. It's probably eating too much, that's 2. And the third, the unholy alliance, the 3 things are smoking. And that's a kind of big issue. It's less than it was, but it's still, if you've got diabetes or coronary heart disease and you smoke, it is really a kind of death wish, if I'm being honest.
So in terms of smoking, another big issue here in Birmingham?
Yeah, we're seeing quite a change in smoking habits. which is good. We've seen over the last 20 years the numbers who smoke has gone down dramatically. Certainly in the Asian community, smoking used to be almost exclusively in men. It wasn't just smoking, it was tobacco chewing and other things, and it nearly always was men.
Changing that now?
Well, I think we need to understand that the first generation Asian immigrants are very different to third generation people who've been born in this country and who had parents also born in this country. And when I walk around Birmingham town centre, I see quite a few people smoking, and I have to say that there are quite a few Asians smoking as well, Asian boys, Asian girls smoking. And I think that we need to get a different message to that group of people, to say that smoking is not very good for your wallet, it's quite expensive, and it's not very good for your health as well.
Really important point in terms of, so we can see that change.
Yeah.
And are we saying it's the younger population now that there seems to be a trend in taking up smoking? Any reason for that?
What I'm saying is that just seeing a community in isolation as being very static is wrong, and that first generation Asians, Afro-Caribbean, I'm Welsh, so first generation Welsh, are very different to third generation, and we need to understand how things change, and we need to understand that third generation Asian kids are probably very similar to third generation British kids, white kids, and they will, some of them will smoke or whatever, and we need to understand that and say, yeah, okay, what can we do to help them?
And what can we do to help them?
There are a variety of things. So we have a stop smoking service to try and help people give up smoking. But it's very difficult. I mean, most people who give up smoking have gone through at least 6 times to give up smoking. So it's hard, actually. Nicotine's very addictive. But it's not the nicotine that kills you. It's tobacco smoke. And when people realise it's not the nicotine, it's tobacco smoke that kills, then that opens up new possibilities. So we're seeing these things, vaping or e-cigarettes, really important, because they don't have tobacco smoke. They still have nicotine, and there's a lot of controversy about whether you encourage people to take up smoking or what this means for younger children, etc. But if I'm advising an individual smoker who's may have diabetes or whatever, heart disease or lung problems, and they smoke tobacco cigarettes, there is no doubt that they will have far less harm by using e-cigarettes. And that's just one of the things that we need to understand and perhaps take forward, that actually it may help people to eventually get off cigarettes and nicotine.
So in terms of, if you've got any viewers out there listening, e-cigarettes, you are saying?
Well, I think the first thing would be try and give up completely.
Right.
If you can't give up, or you had a go and can't give up, try cigarettes. And
we have got, as you said, a smoking cessation service here in Birmingham that can help you.
Yeah.
And you've already pointed out it's very, very difficult. It's about that time in the new year where probably a lot of people have made a New Year's resolution around quitting, and you're telling me that it's something like 6 times before somebody is able to quit smoking.
Yeah, well, but people, I mean, I don't smoke, but people who smoke, and some of the research suggests that it's as hard to give up nicotine as it is to give up heroin and other Class A drugs. So it's really difficult.
Really addictive.
And often what we're talking about, all these resolutions, are actually hard to do. And so my first thing would be, don't give up, but take one step at a time. So that's where e-cigarettes come in, because actually you're transferring from harmful tobacco smoke to non-harmful. You may want to do a bit further then and actually stop completely, but that's your choice. But for God's sake, try and reduce the harm. And also they're cheaper than smoking, so actually it'll do your wallet some good.
And in terms of if somebody has set themselves a goal of actually quitting smoking, I think there's a lot of research to say that if they have that support, and you're more likely to quit as opposed to trying to do it.
Yeah, so why do people smoke? It's often they smoke in groups, and quitting also is actually easy in a group. That's why e-cigarettes are quite useful, because they don't stop that kind of group dynamic that smokers have. You often see people who vape go outside with smokers. So I think it's part of that journey to give up, but it's actually a small step, but a really important step. Because I want to get over to your viewers that if you smoke, it's the tobacco smoke that kills you.
So if you smoke, it's the tobacco smoke that kills you.
Yeah.
So if you're not a smoker and you're exposed to the tobacco smoke, where does that leave you?
Try and get your person, if you live with them or you have to work with them, try to get them to either give up or use e-cigarettes. I'd have to say, I think you've reminded me about New Year's resolutions. Firstly, don't give up. Whatever you do, don't give up. And it may be you've tried to do too much. But if I was to say what are those 2 resolutions I would want your viewers to think about, is firstly, as you go down the road, smile and say hello to somebody. That's probably the easiest thing that you can do.
That's not even on my list, so I have to add that on.
I think you can add to that is make one more friend this year than you had last year. I think the third thing would be use the stairs.
Use the stairs.
But whatever you do, don't give up. Don't do a massive change, and don't give up. And I recognise that what I've said has been quite maybe hard to take in.
And there's so much.
There's a lot to take in. It also may have generated a little bit of discussion. If people want to get involved, we've got a Google Plus, we've got a Twitter account, we use Healthy Brum. Please encourage your users and your viewers to actually use our, contact us or kind of give their view. I'm more than happy to come back if people want to phone in or raise issues from the emails, etc., and talk about some of those things. But actually, Birmingham's a great place to be.
And Adrian, what's your final message for our viewers today?
My final message is don't give up, and make being healthy having fun. If you don't have fun when you're healthy, there's something wrong with you, really.
नाज़रीन, ये थे हमारे स्टूडियो के गेस्ट डॉक्टर एड्रियन फिलिप्स. थैंक यू वेरी मच फॉर कमिंग बर्मिंघम पब्लिक हेल्थ की तरफ से. और इनका ये फाइनल मैसेज है फॉर द सिटीजन्स ऑफ बर्मिंघम, डोंट गिव अप. एंड बहुत सी सपोर्ट और बहुत सी सर्विसेज अवेलेबल है आपके हेल्थ के लिए. उनको यूज़ करें, एक नया दोस्त बनाए, स्माइल करें और बिल्कुल गिव अप नहीं करना. थैंक यू. अगले हफ्ते तक के लिए अल्लाह हाफिज़.